Patience of Reddit, what do doctors do that annoy you? Oh, you have a painful mouth movement caused by your medication that makes it almost impossible to eat and hard to talk. Yeah, I can relate. I have a cold sore. Can be really insensitive. Treat me like an inconvenience. Look, I get it. It's your job. We all have bad days at our job. But you make several times my salary. When I come to see you, I'm probably spending at least a day's pay to see you for an hour. Fucking act like you care for the 10 minutes we actually talk. Not all my docs have been like this, but some have. It bugs me when doctors forget that there are people who are smarter than doctors, but chose a different career. Sometimes, they get so insistent that you should be doing things a particular way that they don't pay attention to the positive changes you've made to your health. I actually left a doctor because, after first telling him I've cut my caffeine consumption from a whole pot of coffee a day to a cup or two, he weaned me a new asshole because I utilize ZZZ Quill on the rare occasion that I drink a cup too late in the day. His words, you'd rather pump artificial stuff into your system to sleep than to just cut out caffeine? Same with diet. He asked if I eat healthy, and I say I eat plant-based most of the time, but who doesn't love a sheets run every now and then? And he focused in on the fact that I eat junk food once in a blue moon as opposed to the complete dietary change from the last time I saw him. Team War. Went to war for the first time ever this past month while I was down in VAP. Still team sheets. As a university student, doctors always assume you drink too much and don't eat sleep well, completely bypassing any chronic illness. Where does it hurt? Here. Toucher. I wish there was a reflex at the same time to punch them in the face when they do that. When it comes to cancer, they all lie their fucking faces off. They don't tell you the actual story. It's all odds are good this chemo will work, when they know sure as shit it won't do a damn thing. My doctor was actually really good about that. He was straight up. Only 13 of people will actually be cured by this chemo. The 5-year survival rate is great, but 23 of people will die of this cancer if it spreads. If you're someone that likes it straight, then that's a great doctor. Well, it's horrifying to hear, but I asked for statistics, so don't lie. Fortunately, I have not yet gotten that far that I need the chemo. We are pretty sure now after my second surgery that it didn't spread, but he was flat out with the statistics when I asked. There's an 80% chance that your cancer didn't spread. If I get in there and it's stage 3 or 4, we'll do chemo, but there's only about a 13 chance that it will cure you. You'll likely make it out 5+ years, 75% chance, because it's slow moving, and you can be put into remission more than once if you're lucky, but only 13 chance of a cure, basically cure meaning a remission that doesn't end. It's not really what you want to hear. I mean, the 80% was pretty sweet, but I feel like it helps me process. No surprises. Doctor, my hair is falling out and getting thinner. I'm only 17, how do we fix it? Oh well, you know you can lose up to 100 hairs a day, so I wouldn't worry. Literally pulls glob of hair from my head. Right, totally normal. I'm totally not going bald, you're right. My ex-husband, not a doctor, used to say that shit to me. I know for a fact my hair got thinner looking at pictures from like a year or so ago. My hair had body. OMG, he always pulled that 100 hairs a day fact in my face. I want to punch him in the face. I'm not a patient, but many of the older people in my life are having medical issues that require medical attention. A pattern I've seen is the doctor makes an assessment of whether a surgery will be successful based only on whether he can complete his specific task. They don't take into consideration the trauma of the surgery and whether the patient handled it. Yeah, haha, I'm a 17-year-old girl and I have some kind of weird dermatitis that makes my scalp super weird. It causes my hair to fall out, and I keep telling my doctor that my hair is falling out, but she keeps saying, well, there are no bald spots, so I wouldn't worry. There doesn't need to be bald spots for your hair to fall out. It's thinning and falling out like crazy. I don't think my doctor ever listens to me, honestly. Make me wait an hour in the waiting room, bro. I didn't make an appointment as an attentive time. Let's go. Exactly. If I'm more than 15 minutes late, you have to reschedule. If the doc more than 15 minutes late, wait longer. Taking their sweet ass time and making you wait past your appointment time. My girlfriend has been having a lot of problems, and the most frustrating thing for her is the doctors put her condition on like the back burner, or don't really believe her and say that it is a certain thing when she has been tested for that multiple times and it's never came back positive. The lack of emotion and sympathy. I had to go to the ER for my first ever gallbladder attack. It was agonizing. I told the doctor my stomach hurt and he suspected it was a gallbladder problem, so he fucking poked my goddamn gallbladder and asked if that hurt. I burst into tears because the pain was unbelievably the worst fucking feeling ever. The doctor coldly said to the assistant, "She's crying," almost in a mocking way, but I suppose it was more of a verbal note to self to describe how bad my pain was. Asshole. They don't listen. My mother could not have the blocker they put in your arm to put you into twilight sleep. I screwed with her breathing and caused complications. I kept telling the guy this, he kept saying, "Well, we'll see what happens." Complications. She had to stay 2 days intubated. I wanted so badly to tell the guy off, to tell him I told you so, to show him the agony he put my mother through. That kind of shit happened too often. Yeah, you're educated with umpteen years of school, but I know my mother. Schedule surgeries in the afternoon, so you can't eat or drink for nearly 20 hours. Make my ride wait in your 70s chic waiting room the entire time, so they can't have lunch or go somewhere more comfortably entertaining. If I'm late an hour, I miss my appointment. If I show up on time, I wait an hour. Try these pills. 2 weeks later made it worse. HMM. Up the dosage. 2 weeks later even worse. HMM. Okay, try these pills and take these to come off the other pills, and these pills are for all the diarrhea coming your way. Fuck that. Goes through a week of opiate withdrawal lying in his own sick in bed and starts smoking cannabis. Some doctors are simply there to push pills. The wait time for a set appointment 3:30 means 4 o'clock to 4:30. I'm not sure about anyone else, but most people have jobs, home and other stuff that rides on the fact that a doctor, even one that you know, will keep you waiting and seemingly not care. If we show up that late, we get charged and can't see someone for weeks. Totally unfair and unethical. The fact that being doctors gives them a pass at having any kind of work ethic or business acumen. When I worked at a hospital, the patients can wait mentality was everywhere. I've personally seen doctors spend well over 30 minutes talking on the phone and eating pancakes while a patient is waiting. The same doctors that have their own practice make no attempt at actually running the place like a business. Overscheduled. Meh. "Oh, this isn't your chart. Sit here for an hour while I find yours." It's absolutely ridiculous what they have been able to get away with. In no other profession would performance like that be tolerated. When I make an appointment with the doctor and end up seeing the PA and still have to pay the same fee as if I saw the actual doctor. You chiseling little asshole. If I'm gonna have to be treated by your little MD1A blackie, I expect to pay significantly less. I know the PA is getting a hell of a lot less pay too. When they put their hand up my anus. When my doctor steals top Reddit questions, changes it slightly, and posts it as his own.